बीपी शर्मा साहब, प्रोफेसर पवन शर्मा साहब, प्रोफेसर निशांत शुक्ला जी हमारे और अगली वक्ताओं में डॉक्टर हमारे अविनाश मिश्रा जी भी आए हुए हैं आज। इन सभी का धन्यवाद भी करते हैं और साथ-साथ हमारे
मैं
अगली
आप सबका
जी, आभार। जी।
आयुष समृद्धि की 757वें ज्ञान गंगा में स्वागत करता हूं। आदरणीय प्रोफेसर निस्तेश्वर सर, बहुत नाम सुना था, आज आपके दर्शन हुए, हमारा सौभाग्य है। आपको बहुत बहुत आभार, बहुत बहुत नमन। डॉक्टर समीर नायक विल ऑल्सो ज्वाइन एंड डॉक्टर यदु गोपन फ्रॉम हसन। तो आज हम बड़े सौभाग्यशाली हैं कि मल्टीपल स्क्लेरोसिस पे आप लोगों के विचार मार्गनिर्देशन सुनेंगे। और तो और प्रांजल जोशी जी जुड़ेंगे लास्ट में, वो भी अपने मल्टीपल स्क्लेरोसिस पर विचार व्यक्त करेंगे। ऐसी व्याधियां जो कम होती हैं, जो आयुर्वेद वाले कम ट्रीट करते हैं, उसमें निश्चय ही हमको सभी कुछ एक इंस्पिरेशन के रूप में मिलेगा, एक मार्गनिर्देशन के रूप में मिलेगा, ऐसी हम कामना करते हैं। मैं आदरणीय अग्निहोत्री सर से स्वागत प्रवचन की आशा करता हूं कि वे सभी का स्वागत करें। आदरणीय अग्निहोत्री सर।
प्रोफेसर पवन शर्मा जी का बहुत-बहुत धन्यवाद। नमस्कार। ये मेरे लिए बहुत ही इट्स अ ग्रेट प्लेजर टू मी दैट टुडे वी आर सेलिब्रेटिंग आवर मल्टीपल स्क्लेरोसिस टॉपिक with the help of the giant persons of our Ayurvedic section and हम तो खाली नाम सुना करते थे। पिछली बार एक बार आप जुड़े हैं, आपके साथी जुड़े थे तो उनसे चर्चा हुई थी। हमारे डॉक्टर के निस्तेश्वर जी का नाम प्रोफेसर आर.एस. सिंह बहुत ही बहुत ही प्रेम से लिया करते थे और मुझे याद आ रहा है 1981 में जो हम लोगों ने 82 में कॉन्फ्रेंस की थी एक, उसमें हम लोग एमडी स्कॉलर थे, तो आपको चिट्ठी मैंने ही भेजी थी जो सर्कुलर फर्स्ट सेकंड सर्कुलर आते थे। बड़ी खुशी है आप विजयवाड़ा से हैं, आज आप ग्रेस करेंगे हमारे आज की वेबिनार को, आपका बहुत-बहुत स्वागत है। और डॉक्टर समीर नायक जी जो बेलगावी से हैं और प्रोफेसर हेड का चिकित्सा के हैं, ये वो दरअसल the hastakshar, these are the so important signatures with their personality that they are doing their job so efficiently in Kajiksa department that he on contact became ready to give some knowledge on the current topic of today's webinar. And so goes the case with our Yadugopan ji. Yadugopalan ji is the same talented person, assistant professor nowadays, that too in Kajiksa department, and we do hope that Hasan itself carries some meaning. I was just reading Mr. Prasanna was also there in our participant list. So Hasan have got a wonderful affinity towards Ayurveda and their products are never less to anybody. They are staunch personalities and we have come across a lot of great persons having knowledge, gaining knowledge from Hasan College. And lastly, Dr. Pranjal Joshi ji will also be here. He will be giving some sort of exercises or therapies which can be helpful for such persons suffering from or taking treatment for multiple sclerosis. With these words, I welcome all these our today evening's guest speakers of a particular unique topic. Thank you so much, and over to Pawan Sharma. Namaskar. आप म्यूट है सर।
बहुत-बहुत आभार सर।
Thank you very much for your affectionate introduction. So actually this is the work entrusted by Chandala ji. उन्होंने कहा आप इसका तैयारी कीजिए और उसको थोड़ा बहुत आपकी विचारधारा उपस्थित कीजिए। तो I started doing it within a short time. प्रमोद हमारे पवन जी जानते हैं। So I'll be talking through my PPT. Can you provide PPT, Sharma ji? Is it audible? Yeah. Okay. So the slide probably you are seeing it, multiple sclerosis, where we have clearly mentioned Anutta Vata Vyadhi. You don't find any such disease picture wherein the symptoms that are noted in multiple sclerosis are akin to Ayurvedic condition. So when we talk about such diseases which are not mentioned in Ayurvedic literature, I always remember one observation made by Mahamahopajay Gannath Sen while writing his work on Siddhanta Nidan after the Pratyaksha work is over. So he has stated that Purana praviliyante navina pradurasate. So new diseases, old diseases disappear, giving room to new diseases. So for Ayurveda is a new disease. Probably sclerosis condition was noted down in modern medicine decades back. That's a different issue. So it is a new disease. How you make an approach when a patient comes to us from Ayurvedic perspectives is the matter to be discussed. First slide. Next. So you got a lot of information on net about multiple sclerosis, and it is a neurodegenerative, autoimmune, inflammatory, and demyelinating progressive disease. This is what they have mentioned. And they also clearly mentioned that it is non-contagious and there is no threat to the longevity immediately. It may make the patient informed a little bit. He cannot move. He may not be enjoying the feeling of well-being, but still it is not so dangerous. Next. When you look at the causes, multiple, next slide. So the causes are categorized under 4 varieties. Immunological, because autoimmune phenomena is involved in that. And viral infection, probably all know it, that we inquire any case coming to us for infertility, male infertility or female infertility. The basic question we ask, have you had any mumps when we are younger? Because mumps virus can cause arthritis and also can cause sterility. So similarly, some viral infections somewhere in the decades of life can be noted, and the scientists attributed it to triggering of the autoimmune phenomenon, but it should have a genetic makeup, that is a genetic lenience or tendency, then only they develop it. Environmental factors are concerned, those who are near equator, they are not suffering. Away from the equator, the poles, because of the less sunlight or whatever may be the cause, the vitamin D is identified here as one of the causes. Genetic factors are always there in MS. Next slide, please. So when you look into the progress of the disease, the categorization of it, they have mentioned relapsing, remitting multiple sclerosis. It occurs in 80% of cases. When it is associated with the remission, it comes to my mind, the Charak is the first scientist who has documented such diseases which are subjected to remission and exacerbation. So first thing he has used in the word is Anushangi, Premeho Anushanginam. So Premeha is a genitourinary disease or urinary disorders where diabetes is also included. Premeha is not diabetes basically. But these category of diseases are having a tendency to reoccur, that is Anushangi. Similarly, our MS is also Anushangi. In 80% of cases, there will be remission and exacerbation, but rest of the things are progressive primary, progressive relapsing, and secondary progressive multiple sclerosis. So these are the categories they have given basing on the symptoms that are subjected to aggravation or being reported by the patient. Can I have next? So when you look at what are the major symptoms that are encountered? So pathophysiology is concerned, this is a blood-brain barrier that hits the thing. isn't it? So, and as you all know it, fat-soluble alkaloids or a substance can cross the blood-brain barrier because this is a cover created by God or nature. So the T lymphocytes that mature in thymus gland, they try to enter into the cross the blood-brain barrier, wherein they create a way which results in demyelination process. So these create antibodies. Antibodies will destroy the oligodendrites, causing demyelination, in which initially there is inflammation. So when you look at this as a Sclerosis, and inflammation soda is that one which triggers the rest of the process. That is important. Because once you understand the pathophysiology, what they are trying to communicate to us, we can plan our treatment with the Sodahara drugs if at all it is reported early in its stage. Then Gugulu-like drugs may be useful. After some time, whenever the flakes are formed, there is a breach in this myelin sheath, then the Gugulu may be contraindicated. This is a clinical discussion one has to take into the consideration. What could be the stage, what is the duration of the disease, and what are the symptoms, whether they speak about the stage of the disease, then the treatment modalities will differ. And symptoms are concerned from musculoskeletal, visual, some sensory, related to speech, eye, throat, and also related to the large intestine, kidney, in the urine, samanya mala jo bhi hai, purish and mutra, there will be incontinence, there will be excessive flow of the urine, constipation or diarrhea. So when you look at these symptoms, I can have next slide. They have created a triad, very important to emphasize, known as Charcot neurologic triad. Let me have another slide, please. Next. So in that, either it can call it as SIN or Charcot triad. SIN means scanning speech and intention tremor nystagmus. Otherwise, you can call it as nystagmus, ataxia, and dysarthria. So two of them are related to sensory and one is motor. These three things are usually reported in majority of the cases. Coming to the diagnosis of the disease, neurological examination is usually carried out by the physician. Next, if multi-brain MRS can also give some information about the stage of the disease, and multiple sclerosis present in high percentage of protein IgG that can be estimated in cerebral fluid. These all are the confirmatory tests to make a diagnosis. Probably etiological factor may not be identified truly, but an attempt can be made to make a diagnosis of MS. Next, assessment score is concerned. This is very important. Whenever we take up a case of MS and giving an Ayurvedic treatment protocol, the progress, the benefit of the treatment or progress of the disease or reduction of the symptoms, we have to give in an objective manner. For that, one scientist has designed it, disability, expanded disability status scale. This is now globally followed to say the effectiveness of the treatment or the drug under evaluation. So where the scale was expanded from 1 to 10, 10 is dead, 9 is confined to wheelchair. So the mobility that is there in the patient is categorized as minimal, moderate, and severe. So this scale is used, and I have gone through certain clinical reports where the scale is applied and evaluated. So this is the easiest way where we can do. And next, coming to Ayurvedic perspective, as I have rightly told you, it is a degenerative condition where rasayana, dhatukshaya indicating rasayana drugs are to be given. Initial triggering of the disease starts with inflammation. Sodhara drugs are to be given. And the functional aspect of Sclerosis, we have to look into that. And when we talk about that, it is involving one of the three marmas, that is Sira. And that's why we have to take every care while dealing with this drug. Though MS is not at all reducing life expectancy, but according to Ayurveda, the Sira is Adhisthana. We have to take every care, and wherein the Rasa and Majja or Shrotas are involved. Because with that view, we can say it is a Vata that is all pervading. Pranotar Murdagaha, Pranavata is there. And its control can be through Apanavata also. Prana, Apana are the main things. Next, the factors involved is Shrotorodha. Next, please. Can I have next slide? Anybody there? So, Shrotorodha, Tridosha, that is mainly Vata dosha, Voja Vikruti, Majja Dhatu Kshaya, and Mastulunga Kshaya. Here, Asanga Sangra and Tikakara Hindu, they have clearly defined that Medodhatu contributes for Majja Dhatu, and Mastulunga is considered as Majja Dhatu because of the fact that it is present in flat bones of the skulls. So basing on this, when a myelin sheath is interpreted as a derivative of Majja Dhatu, we are more inclined to draw a line, a treatment protocol, taking Majjavaha Shrotas into the consideration. So when you look at the Aharaja, Viharaja, Manasa, Majjavaha ni Dushyanti, Viruddhanancha Sevanat. Viruddha Ahara is the most important thing here. So next slide. Next. So Viruddha Ahara, how it acts? Probably the only system of medicine which has observed that negative emotions also disturb the digestion, leading to ama formation. Isha Bhaya Krodha Pariplutena, Lubdena Rubdainya Nipiditena, Pradvesha Yuktena cha Sevyamanam, Annam na Samyak Paripakameti. Though the modern medical system not categorized MS as a psychosomatic, according to Ayurveda, is 100% psychosomatic in nature. So all negative emotions contributing for ama formation, and ama goes to the proportional transformation of ama visha, which is directly linked up with the immunity. So naturally, this is the Viruddhanancha Sevanat, Majjavahani Dushyanti will have a relevance in this context to discuss. And the Atipravrti Prakupita Vata, as you all know it, Shrotasam Dushlakshana Atipravrti Sangova, Sirana Grandayopeva, Vimarga Gamananchapi, Shrotasam Dushlakshana. Which type of Shrotodushti is seen in MS, basically? So, Atipravrti is there, but there are flake formation in the conjugates, Shrotas, that may be interpreted as Siragranthi. Flakes are something abnormal, what we call substances, that also they obstruct the impulse that is passing through the Shrotas. So Prakupita Vata leads to Astimajava Shrotodushti, and that's how we theoretically draw a line. At times we are making a theoretical threadbare analysis. Practicality is when you make a therapeutic protocol. Next. When you look at the symptoms are only translated here in this slide, basically. that is Sandhi Vishlesha, looseness of joints, and Gatrasa, the weakness of the body. Kriya Sannirodha, inability to perform normal functions. Shrama, lethargy, and a set of things which you can read in this. And mental disturbances are there, leading to at times pralapa, that is delirium, loss of sense, and pain in the bones, etc. So most of them are related to Vata Prakopa, and rest of the two doshas also contribute for it. Next, when you look at the pradoshas vyadis that are mentioned, that is important because I am drawing all the line of treatment before we draw. What are all the concepts to be considered to arrive at a therapeutic protocol? So protocol can be drafted when you take the Samprapti Ghatakas. Samprapti Ghatakas are Agni, Dosha, Dhatu, Mala, and Shrotas. So attempt is, when you look at the Pradoshas Vyadis described by Charak, and under Majjavaha and Rasavaha is also involved, unless it triggers the Rasadhatu Agni, because the other dhatus are dependent on first dhatu. So Rasadhatu is also involved and symptoms are contributed for it. Next, Majja dhatu, if you can go through it, Rupparvanam, Brahmo, Mucha, Darshanam, Tamasastudha, Arusham, Stola Molanam, Parvajanancha Darshan. So when we talk about scleroderma, where the sclerosis is also involved, the signs and symptoms of that particular condition probably more akin to Vata Rakta. So the majority of the conditions of Majjava Shrotas may contribute for a different condition like scleroderma, but Mucha, Darshana, Stamasa related to what we call nystagmus and other eye conditions, we are trying to link up with Majjavaha Shroto involvement in this. So when you look at this Majjavahana Shrotasam Aushadam, Majjavaha Sukra Samudhatanam Aushadam Swadutiktakam. So the drugs which are predominantly of Madhura and Tiktarasa should be advocated in this. We will be speaking on that at a later time. Next, so some of the scholars whom we have discussed, they are of the opinion that Sarvanga Vata Chikitsa is included. Avruta Vata should be taken, whether it is Kapha Vrata, Pitta Vrata. It should be Kapha Vrata basically. Because Majjava Shrutodusti, the external factors, Utpeshat, Atyabhishandat, Abhigata, Prapidana, all these Atyabhishanya is definitely contributing for Kapha, and Kapha Vrata Vata can be thought of. And Dipana Pachana is the main thing because Ama that triggers Pachaniya Ushada is the first line of treatment. And Lakshanika Chikitsa and Rasayan Chikitsa because it is involving degenerative process. So Sodahara, Jivaniya, Brahmaniya, Balya, and Vayastapaka. These are the group of drugs which are to be taken into the consideration whenever you plan a yoga or a therapy. Why? Jivaniya, Jivanam, Ayush, Ayuhu Tashetam Jivaniya. And Bala, why you have taken Bala group of Mahakashai, you can take, because if your mind cannot work beyond that, there is a already ready-made list with us through Charak Samhita. Prakrutastu Balan Seshma Vikruto Mala Uchite Sachay Oja Smrtakaye. So Oja and Prakruta Bala, Prakruta Kapha, all are related to Bala. So Balya Dasemani, Brahmani Dasemani, why we give Sajju the Vata, Vayastapana to halt the degenerative process. So taking into all these things, these are the actual concepts that are to be involved while drafting a drug or drug formulation for us. Next. So treatment at a certain level of the body, well-balanced food to be taken, because Abhyanga, Dhara, Udvartana, Brahmana Dravyas are all involved. This is a general line of treatment for any Vata condition which is to be adopted. So, how you draft a protocol? Next slide. This is a new condition not described in Ayurveda. How you tackle it? Acharyas have given us a scope to plan a treatment for a disease which is not named in Ayurveda. To share with you, all experienced doctors and other speakers. Recently, I have come across a condition which I heard from US. One of my relatives hospitalized. They sent me all their data of case reports, suggesting me some drug. And I was first time coming across such condition or heard of it, abdominal compartment disease. So they are coining new nomenclature for the conditions which is already not described in earlier medical books. So if you're not knowing the condition, Acharya has given us, don't feel shy. Najihriyat kadachana vikaranam kusno najihriyat kadachana nahi sarva vikaranam namatosti dhruvasiti. This was quoted by Vagbhata. Once again, quoted by Bhava Mishra, nothing else. So what could be the other way when you are not knowing the name to go to the plan of the treatment or the textual information? Here, once again, Sushruta is given and it was also copied down by several Yoga Sangra Jamandas. Nasirogo vina doshaya tasmat chikitsika anuktamapi doshanam lingai vyadhi upachare. So dosha linga is to be taken and a treatment should be followed wherein the disease name is not known or disease were not at all recorded. So with these guidelines only, we attempt to treat multiple sclerosis cases from Ayurvedic perspectives. Next. So to my mind, what I have treated 2 or 3 cases, not with much success rate basically, but I have adopted this because it is Adhisthana Isthira. The rest of the purificatory conditions can be implied, either it's Sharira Janam, Doshanam, Kramena Paramoshadam, Vastir Vireko, Vamnam, Tada, Telangritam, Madhu, Vastir is sea tanker, Shodhana therapy. But at the same time, Charak has used his clinical discretion, though Pakshagata is categorized under Vataroga, he has given Snehana Svedasayuktam Pakshagate Virechana. He has not preferred Vasti there. Similarly, in the management of MS, looking at the Adhisthana of the Vyadhi and Nasa is Dwaram, Nasya Karma should be included invariably. So there also, my clinical discretion is, if it is a Vata dominant symptoms are there, patient belonging to Vata Prakriti, I prefer Kshirbala or Mahamasha. Otherwise, in Pitta dominant cases, I will go for Narayana Taila or Shadbindu. Because Narayana Taila consists of Shatavari is Pittahara. Shadbindu contains Bhrangaraj Pittahara. If Kapha dominant condition or Kapha Prakriti fellow, Dhanvantari is given. Why? Because Dhanvantari contains Kuludha, which is Kaphara. So this clinical discretion at least you have to take when prescribing oil for Nasya Karma. And next, Rasayana. Rasayana therapy, already Deghamayu Smritir Mera Arogyam Taranam Vayaha, Dehendriya Balam Param. So it contributes for Bala, immunity. Indriya Bala is also needed in MS. So Rasayana drugs have to be given definitely. There is a formula given, Ashwagandha, Shatavari, Amalaki and Sangapushpi, increasing strength and nourishment to the brain tissues according to one observation. And Narasama Rasayana and Gandhar Vasa, the Arandataila, you can design your own Rasayana drug for it. And among Rasayana drugs, when you look at it, Charaka Samhita's information is very useful for us. Next slide. You have to consult AYUSH. Next. AYUSH given in Ejapurshia, Ajay. Let me have next slide, please. So, Rasna Vataharanam, Eranmulo Vrishi Vataharanam, Gokshura Motrakuchharanam. So, all these three drugs are useful even in management of MS. Please, next slide, please. Hello. So, Ashtanga Sangraha has added one more drug for Vatahara property, not Rasna. Along with Rasna, Lasna is added, and also Gugulu is added. So naturally, Rasna, Lasna, and Gugulu can be considered, and the various yogas are there with which you can take a clinical discussion. And scientifically validated drugs are there, taking into the pathogenesis of MS, where it is autoimmune disease, it is a degenerative disease, and inflammatory process is involved. We have to look into anti-inflammatory drugs and immunosuppressant drugs, and also neuroprotective drugs. A lot of data is available through various monographs, and I have come across anti-multisclerosis, wherein two drugs are mentioned here. Can I have next slide? Curcuma longa and cannabis sativa. So, next slide, please. Next. And anti-stroke, Withania somnifera, ashwagandha, and shunti. Immunosuppressants are Punarnava, Sariba, and Caravellak, Sversa Charayata, that is Keratic, and Haritaki and Ashwagandha. Neuroprotectives are Benicassa, Espida, Kushman, Camifora, Viti, Gugulu, Inula, Esmosa, Glycerisa, Glabra, Osmum sanctum, a set of things what are there before us. Withania somnifera also contributes for the growth of neurons. A myeloprotective is given. So, next slide, please. Out of this, Bhanga, which is not mentioned in Ayurvedic literature of classical age, Samhita period, and you come across Bhanga preparation slowly crept in, and now it is a addiction forming drug. So Government of India will not allow you to grow it unless you have a license. Next slide, please. So cannabidiol. I know that Sri Lanka is the first country which has given a license openly the application of cannabis in the management of cancer patients who are receiving chemotherapy. So there it controls the nausea, and also up to some extent it causes analgesia as an analgesic. In experimental models where multiple sclerosis is produced, that condition, tremor that is produced, is controlled by cannabis. So this is one report. And similarly, reduction in tremor with other drugs are also reported. Patients suffering from muscle spasticity have benefited by cannabinol treatment. So naturally, the cannabis sativa, that is Bhang, is one of the important drugs in the management of MS. And next, can I have next slide? Next slide. Next slide. So, Gugulu Medo and Laharanam. Why Gugulu? Where Gugulu is to be applied, I have clearly discussed earlier in my slides, that to reduce inflammation in the early stages of multiple sclerosis reported, then Gugulu to be given. At a later stage, probably Gugulu is having some amount of lacania property. It may impair a remyelination process. That is my view. We have several drugs that can be safely prescribed. I don't say it is a contraindication. Definitely, it is a point to be taken note down instead of blindly prescribing tons of Gugulu to the multiple sclerosis patient. So next is Gugulu is definitely hypolipidemic. It is anti-thyroid factor. It stimulates the thyroxine and useful in myxedema. Definitely, but cannot be blindly prescribed in MS cases where the stage of the disease to be taken into the consideration. Next, Curcuma longa. Next slide, please. Curcuma longa is also reported to have an activity. Experimentally, allergic encephalomyelitis EAE serves as an animal model for MS. So in vivo experiments, oral intake of curcumin significantly reduced duration and clinical severity of demyelination in EAE. So this is the one which has given some amount of scientific evidence, and in vitro studies, it is also useful in several viruses, including HIV. But as far as MS is concerned, definitely it is acting on stalling or preventing demyelination process, and also brain lipid peroxidation as an antioxidant. That is also coming under the rasayana activity. And next slide, please. I have given references here. You can go through where from I have taken this information. Glycyrrhizia glabella, initially it was considered as a phytocortisone. Where cortisone is applied, this drug can be given. Cortisone is the prime drug for autoimmune disorders as an immunosuppressant. We all know it. It contains glycyrrhizin, glycyrrhizic acid. Initially, it has entered into modern medicine as an anti-ulcer agent to reduce the peptic ulcer symptoms. And later on, they have started giving less importance to it because of its side effect, as it retains the sodium ion and shoots up the blood pressure, and it should be carefully applied in cardiac patients. We give as a crude drug if the isolate may be having that activity, but after giving a crude drug tablet manufactured by Himalaya Drug Company, I have noted in my patient that it is definitely influencing and shooting up the blood pressure, so hypertension. So we have to carefully take a note while prescribing Estimadu, but definitely it is one of the important immunosuppressant drugs so far reported. Next, Britannia somnifera. Britannia somnifera is also a very useful drug. And it promotes the dendrite formation, and it is reported to have a specific activity when it is screened in neuroblastoma. Further studies led to identification of 6 compounds which are having a neurite growth outgrowth activity. So that's how definitely the pathology can be reversed, or the onset of the progress of the disease can be prevented by applying Britannia somnifera. So next slide, please. Somewhere or other, they have not shown here. This drug is Anukta Dravya. Somewhere or other we got when we were searching out. And this is a evening primrose, Onanthera biensis. So the seed oil is reported to have a specific activity in multiple sclerosis. Probably, as per the research, several studies or reports have been published on the net. You can also search out. Next, so regulatory effects of hemp seed or evening primrose oil supplements have been reported to have a specific activity in experimental model screened with autoimmune encephalomyelitis. And some clinical studies with a double-blind randomized clinical trial, 52 patients. I can say this is a major clinical study with a herb that is reported. 52 patients with MS were chosen and categorized into two groups, and the drug was given and a placebo was run in the clinical trial, and the therapy shown after 3 months a good improvement before and after treatment evaluation. So significantly increased cognitive function, vitality, and overall life satisfaction, and reduced pain and fatigue. So feeling of well-being can be restored with this drug, though it is not described in Ayurvedic literature. And studies definitely confirm that it definitely merits a consideration. So next slide, please. So detoxification of the body regularly, avoid self-medication, health exposure to natural sunlight, as vitamin D is also identified as one of the environmental factors. Keep body well hydrated, increase the antioxidant intake because it is a degenerative condition, rasayana drugs to be given, and acid and fatty foods, avoid stress. This is the most important thing, because according to me, when we consider this Ama and Vyadikshama Shakti and all those factors, definitely it is a psychosomatic nature. Stress may contribute. Modern medical scientists may come up with another study where they are identifying the stress role in modification of the disease outcome. Next slide, please. So among the diet, you can also include oats, because oats is reported to have a prevention of amyloid formation, amyloidosis. So in such conditions, because of B-sheet-rich secondary structure is associated with human diseases, including central nervous system. So oats can be suggested in the food as a food item, either at the breakfast with the oatmeal, they can start. Next, coming to yoga postures, we are not well versed with that, but certain papers have been published where for MS, the yoga postures are suggested. If a patient is suffering from already locomotor involvement, it is not possible at all, then the best yoga is go for breathing exercises where the respiratory system can be spared from it. So though it should be adopted under a trained yoga therapist, but definitely these are the yoga postures suggested in MS. Next, some research papers have been published, which I am bringing to your notice. Some thought process has taken place about MS management from Ayurvedic perspectives, and this is evidence. 2 case reports I have come across, very nicely reported, with Ksheravasti, Anuvasanavasti, followed by that, and certain formulations which are popular in South India, and Kerala Panchakarma procedures, which are Porokarmas or actual Panchakarma like Navarkishi and Tailadhara, Sirovasti. All these things are involved in that in their treatment protocols, and they have reported a partial improvement, but a case report is worth considering, because one major inventions have come through one single case report. We cannot ignore. So I'm happy when I have gone through these reports that are published, and more validation as it has happened in one Anukta Dravya, which have shown prime rose, evening prime rose, 52 cases they have documented. That too, it is a double-blind study. Such studies should be taken up with Ayurveda treatment protocols to infuse confidence that we can also manage the cases. Next. So at the conclusion part is considered. We're coming to a conclusion basically. So multiple sclerosis treatment protocols from Ayurvedic perspectives, a dosha, that is vata, is to be considered. Shrotas as Majja Dhatu according to Vagbhata and Hindu Tikakara, a derivative of Medo Dhatu. Myelin, Majja or Shrotas should be taken into the consideration. According to the Adhisthana, it is Siras, Nashyakarma should be given a due importance. So autoimmune phenomena developed by Ama and Amavisha. So Pachana drugs are to be given. A Pachana may act as immunosuppressants. We have reports with antioxidant autoimmune with Sunti also. So Brahmana, Snehana, and Svedana Upakramas are to be considered because basing on the Shadupakrama. Among Shadupakrama, 3 are contraindicated, 3 are indicated. So Brahmana and Snehana, Svedana are needed for the management of remyelination process to be accelerated. Drugs like Vatasamana group, Rasaskanda group, Agraushadhi, Rasayana group can be taken. Lifestyle modifications are mandatory. And the scientific validation reported with autoimmune phenomena, that is immunosuppressants, neuroactive drugs, or what we call MS conditions, anti-stroke diseases, Vystopana drugs. So we can prepare to bring out a palliative yoga, Samana yoga formulation consisting of Guduchi, a Rasayana, and also included in Vystopana, Estimadu. Both Guduchi and Estimadu are major Rasayanas. Ashwagandha, par excellent drug, having 45 metalloids, having both immunosuppressive and immunostimulant activity, a best immunomodulator. Gugulu as an anti-inflammatory. Haridra also useful for remyelination. Rasna, Bhoksan, Katuki, Sunti, Lasuna, and Bhalata. These are the drugs which are to be considered. Bhalata containing Sarpi is there, Grita, Panchatikta Gugulu Gritam, that should be given as a Nicha Sneha Dravya, Pratimarsa with some or the other according to the dosa involved. And Bhalata containing yogas in kapha dominant conditions can be given, as my favorite sloka, Kafajo Nasarogosti, na Vibandossi Kashina, Yenna Bhallatakam Hanyat, Sigram Medagini Vardhan. So there are contraindications, there are indications of the drugs. Unless you have a proper Shastra in your hand and mind, you cannot design a drug for it. Next, it is a broken butterfly, but still it can survive without feathers, without wings, isn't it? Multiple sclerosis awareness program. This is the message. So once again, I thank the organizers for giving me this opportunity. And I should acknowledge within a short notice, lot of strain was taken by my colleague, Dr. B. Prasannaji, assistant professor in PG Center in Vijayawada. And with her efforts only, I could able to bring out a PPT and present before you. And I thank Chandolaji for coaxing me to accept the request. And I thank Sharmaji for giving me sufficient time to deliver. Thank you.
Thank you very much, sir. Thank you very much. So nice of you. So nice of you. आप जुड़ते रहिएगा, यही हमारी प्रार्थना है. कल भी हम आपसे नेक्रोटाइजिंग फैसिलिटीज पे ज्ञान लेंगे. Thank you very much, sir. और मैं कल
I thought I leave the place for some time to attend my personal work and come back and join.
Thank you. Welcome. Welcome.
Sharma. Thank you.
Thank you, sir.
Thank you.
So now I would like to request Dr. Yadu Gopan. अग्निहोत्री जी थोड़ा संभालिएगा, मैं पैक कर रहा हूँ. 5 बजे की फ्लाइट से निकलना है मुझे.
अच्छा अच्छा अच्छा.
वैसे
हमारे निष्ठुर सर ने बहुत ही बढ़िया बात कही.
बहुत
हमें
अच्छा, बहुत अच्छा.
नाम बहुत ही एक्सीलेंट, ग्रेट कि नाम पर नहीं आना. अगर आयुर्वेदिक औषधि में नाम नहीं दिया है तो हमें नहीं ना. और उन्होंने जो संप्राप्ति का विघटन बताया, साथ साथ जो प्रोटोकॉल ऑफ द ट्रीटमेंट दिया, एक्सीलेंट था. बल्कि हेम्प की भी बात आ गई, तो हेम्प की कुछ चीजें ऐसी हैं जो हम आजकल विशेष रूप से ध्यान दे रहे हैं, तो उसके लिए भी गवर्नमेंट थोड़ा मोटिवेट होगी तो ट्रीटमेंट रहेगा. यस सर, थैंक यू सर.
I welcome Dr. Yadu Gopan. Welcome, Dr. Yadu.
Thank you, sir. Thank you, sir. Sir, am I audible, sir?
Yes, you are clearly audible. Please open your video.
Yes, sir. Yeah. Okay, sir. So, can I share my PPT, sir?
Yes, please share. Please share.
Okay, okay, sir. Is it visible now, sir?
Yes, carry on.
Okay. So, first of all, I would like to thank the coordinators, Sharma sir and Agnihotra sir, all other coordinators for giving me an opportunity to be a part of this great venture, that is a webinar. This running since so many days, having almost 757 episodes. So I would like to thank you, sir. And it's another opportunity to share a platform with a great scholar of Ayurveda like Nishteshwar sir. That is also my fortune. So I would like to thank for that also. So without any delay, I would like to go to my topic. So almost that is multiple sclerosis, Ayurvedic understanding and management. So in the introduction part, so almost all the modern parts were told by Nishteshwar sir, but still some of the parts I'll like to explain. That is, it is an obviously we know autoimmune inflammatory disease of the central nervous system, and there is autoimmune reaction happening against the myelinated axons in the brain. So there is destruction of the myelin, which is known as a demyelination, and in this case, it is almost a gradual process, gradual course of the disease, where almost 30% of the patients will attain significant disability within 20 to 25 years of the disease. So there can be a relapsing or remitting pattern in most of the cases. And that is like, for example, some episodes of the neurological deficits or symptoms may be seen. That is, for a short period, there will be symptoms, and another short period, there will not be any symptoms. Later, again, the symptoms will be coming back. So that in that manner, let us say, episodic neurologic deficits will be there in this. And a very few percentage of the people will be having a continuous progressive neurological deterioration. So this is the prevalence. So if you see the prevalence in India, again, it is a lower prevalence. That is 1 to 3 per 1 lakh cases are reporting. So it is a very low prevalence, and we are getting these cases very rarely. So obviously, regarding the causes, it is unknown cause actually, but there is a autoimmune inflammation and a demyelination, and a strong genetic predisposition is also there, which is again triggered by some environmental factors like viral infections, vitamin D deficiency, and other environmental factors like, for example, sunlight exposure and excessive intake of cow milk. That is also told by the modern science. They tell excessive intake of the cow milk is also a nidana cause for multiple sclerosis, or a trigger, because it is having more saturated fat. That's why it is also considered to be a cause for multiple sclerosis. So here again, the pathophysiology is already explained by Nishteshwar sir, where there is activation of the because of the nidanas, there will be activation of the myelin sheath and myelin reactive T cells, which will lead to cross the blood-brain barrier, and the blood-brain barrier will be broke down. Then there will be immune cell recruitment into the CNS, and there will be inflammatory cytokines will be produced, and antibody reaction will be there, ultimately leading to the inflammation of the myelin and demyelination, and at the last there will be neurological dysfunction. So this was explained already. So these are the symptoms mainly seen in the, we can classify it into primary, secondary, and tertiary symptoms. Its primary symptom, especially weakness, paresthesia, shaking, tremors will be there, loss of vision, pain, paralysis. These symptoms can be seen, and bowel bladder problems will also be there. And secondary and tertiary symptoms are nothing but the complications of these same symptoms, like bed sores can be there, urinary tract infections can be there, or poor decreased quality of lifestyle will be there. So these are the complications. And again, the classification, that is different based on the pattern of the disease progress. It can be classified into progressive relapsing MS, secondary progressive MS, primary progressive MS, and the most common is the relapsing remitting MS. That is almost 85% of the cases are this RRMS cases. So diagnosis, again, diagnosis criteria are there. So we have already discussed. And again, management also, as per modern, again, in the emergency situations, it is managed by the acute, like initiate emergency supports, and again seizure precautions, and again the other emergency managements are done in the emergency stages, and the vitals are monitored. And in the acute relapse, like there is steroid drugs are given, like dexamethasone, prednisolone, and again plasma exchange is also method in the acute condition. And again immunomodulatory therapies like interferons, sphingosine, these are the immunomodulatory therapy suggested by the modern medicine. So again, coming to the Ayurvedic part, our area of concern, that is, so in Ayurveda, we cannot directly, correlate this disease with any single disease in Ayurveda. As like Nishteshwar sir also told, it is not possible to consider a single disease as a correlation for MS, but so we can consider the Anukta Vata Vyadhi and the other related conditions, like, for example, these are the concepts which can be considered. That is Vata Vyadhi, Snayugata Vata, Majjagata Vata, Snayu Shoshana, Pakshagata, Dhatu Kshaya. These are some conditions which can be considered when we talk about multiple sclerosis in Ayurveda. So obviously, as Nishteshwar sir told, it is starting from the Rasavaha Sroto Vikara, then leading to a Medovaha Sroto Vikara and Majjavaha Sroto Vikara. So mainly these Srotas are involved. Rasa, Majja, and Meda Srotas are involved in this condition. So if we go for the Nidana again, Bija Dushti, that is genetic predisposition is there. Agni Madhyakara Nidanas, because Ama is generally correlated with the autoimmune. Ama and Ama Visha or Ama Dosha are considered to be the autoimmune reactions. And again, Vada Prokopaka Nidanas and Ama Vada Nidanas can also same seen in this multiple sclerosis. So for the Samprapti, again, I told it's not possible for the correlation with a single disease. So again, it is made based on the dosha, dushya, and the srotas. All those things are considered. So different stages of pathophysiology of multiple sclerosis can be correlated with the different Ayurvedic concepts also. So again, this is a probable Samprapti, we can say. So I would like to explain, just like in the how we explain the Amavata Nidana according to Madhava Nidana, similar way we can explain in the Samprapti of multiple sclerosis also. That is, there will be Nidana Sevana leading to different, two different conditions. Sir, am I audible, sir?
Quite nicely.
Yes, clear hai. Aiye.
Okay. Yes. So the probable Nidanas, like Nidana Sevana, can lead to two conditions here. That is, one is Agni Mandya and the other one is Vata Prakopa. Agni Mandya will again directly lead to Ama Utpatti in the Amashaya. And as told in the Amavata Nidana, that is Vayunam Prerito Hyamam Shleshmastanam Pradavati. That is, the Prakupita Vada, due to its own Nidana, will take the Ama to the Kapasthana, Shleshmasthana. So Madhava Nidana explains only Shleshmasthana. So here we can include, if we consider rheumatoid arthritis as the Amavada, Shleshmasthana will be the Sandhi there. And again, in this condition, the Shleshmasthana can be the Mastishka itself. For example, Mastishka is a sthana for Kapha. And again, in Mastishka, especially we have Majja and Snayu. Snayu here means I am correlating Snayu with the myelin sheath or the neurons here, because as we know, myelin is made up of lipid. Lipid is the main constituent of myelin sheath. So that is nothing but correlating with the Medodhadu, and Snayu is nothing but an Upadhadu of Medodhadu. So Majja, again, that is as per Sushruta, Mastishka is nothing but the Majja itself. It's a Avili Gridagara Mastishka Majja. So Majja and Snayu are involved. So in this case, we are considering the Kapasthana as Mastishka Majja, that's Majja and Snayu. So the Ama is taking the Sthana Samshaya in the Mastishka, that is especially in the Majja as well as, in the Majja as well as Snayu, that is in the brain as well as the neurons in the myelin sheath. So there what happens, once the Sthana Samshaya occurs, obviously there will be Dosha Dushya Sammorchana, and there will be Sthanika Dosha Prakopa also. That is, Sthana Samshaya will lead to the Sthanika Dosha Prakopa in the form of either Vata Prakopa or even Pitta Prakopa. Here we can correlate the Pitta Prakopa with the inflammatory response, which is caused by the autoimmune condition. So inflammatory response, that is that we can correlate the Pitta Prakopa. That's Pitta, the Ama, Amena Tena Samrukta, Dosha, Dushyacha Dushita, told by Ashtanga Hridayam. So that Pragupita Pitta and its function can be correlated with the inflammatory response, whereas the demyelination and the scarring can be correlated with the Vada Karma or the Vada Prakopa Lakshana. That is so. In the Sthana Samshaya, that is especially in the Majja and the Snayu, there will be Vada and Pitta karmas, the pathology will be happening, that is in the form of inflammation as well as demyelination, ultimately leading to the neurological dysfunction. So this can be called as told as a samprapti of multiple sclerosis in Ayurveda. So ultimately, what are the dysfunction happening here? Means one is the Snayu Shoshana. That is, Snayu Shoshana here is nothing but the demyelination caused by Vata and Pitta. So Snayu Shoshana or Snayu Gata Vata Lakshanas are told, where we have Bahyabhyandharayamam, Khalli Kubjatva Mevacha, Sarvanga Evanga Rogacha, Kuriya Snayu Gata Anile, told by Charaka. So all the neurological diseases, especially that is Sarvanga Roga, Eganga Roga, Pakshagata, Khalli, Kubjatva, Bahyayama, Andarayama, everything is Akshayabhaga, everything is told in the Snayu Gata Vigara according to Charaka. So neurology, Snayu, in this context, we consider it as the nerves and the neurons. Okay. So again, the Majja Gata Vada Lakshanas are also told, that is Hedo Asti Parvanam Sandhi Shulam Mamsa Balakshaya Aswapnaha Sandadarupcha Majjasti Gubidyanri. So Mamsa Balakshaya, that is the muscle weakness can be seen in this condition. Then Aswapna, that is the loss of sleep. Santadarupk, that is nothing but the neuralgia or the nervous pain. These symptoms are told in the Majjagata Vada Lakshana also. So ultimately, Snayugata Vata and Majjagata Vada can be considered as the neurological dysfunction in this case. So if we go for the Lakshanas here, first thing is the Balakshaya, that is weakness will be there. Cheshta Nasha. So Cheshta Nasha we are taking from the Pakshagata, because Pakshagata is one among the Snayugata Vigara, and the affected organ is brain itself. So loss of motor function. Achedana as per Sushruta, that is Chedana Nasha, loss of sensory function. Sukti and Swapa from the Vada Prakopa Lakshana, that is numbness and paresthesia. Kampa, that is tremor, Vada Prakopa Lakshana. Santada Ruk coming under the Majjagata Vada Lakshana, that is neuralgia. Mamsakshaya, again in the Majjagata Vata, that is muscle weakness. Aswapna, one among the Majjagata Vada Lakshana, loss of sleep. Then Apana Vata Vaigunya can also be seen, that is in the form of bowel and bladder dysfunction. Then Vaksanga, one among the Pakshagata Lakshana, that is dysarthria can be seen. Then Indriya Vada, again Indriya Gata Vata Lakshana is Indriya Vada and Indriya Nasha, told by Charaka. So here loss of vision or loss of hearing can be considered as the Indriya Vada. So these are the Lakshanas of multiple sclerosis according to Ayurveda. That I have collected these Lakshanas from different other topics. So the Chikitsa, while coming to the Chikitsa again, we need to go for different sets of management. That is like Ama Chikilsa, Vadasya Upakrama, Snayugata Vada Chikilsa, Majjagata Vada Chikilsa, Majja Pradosha Vyadi Chikilsa, Pakshagata Chikilsa, and Balya Chikilsa or Nadi Balya Chikilsa. So we told that we are considering the autoimmune reaction as the Ama Lakshana or Ama Visha Lakshana. Obviously, Ama Pachana should be done first. For that purpose, we are doing Koshtagata Ama Pachana and Shagagata Ama Pachana. That is because we need to go for the Ama Pachana in the Koshta first thing. That is Pachana Deepana should be done in the while using the Shadharana Churna. Shadharana Churnam or Shadanga Paniyam, Amrutotram Kashayam, Guduchyadi Kashayam. These are the things we can use for the Ama Pachana in the Koshta level. Whereas in the Shakha level, we can go for the Rukshana or the Svedana. Rukshana by the Sarvanga Udvartana or Svedana by Parisheka Sveda. Parisheka Sveda. So in our clinical practice, mainly we have seen, especially for the super paresthesia or the such lakshanas, Parisheka Sveda can be considered as one of the best option for the super paresthesia or the numbness or the burning sensation and all. That is Dashamula Kwata and Dhanyamla can be used for the Parisheka Sveda. So by doing this starting line of Langana, that is Langana in the form of either Koshtagata Amapachana and Deepana, then Shakagata Amapachana by Rukshana and Sweda. These are the different methods of Langana can be adopted. So by doing this, initially we are doing the Amapachana. Then we can go for a Koshta Shuddhi and Vatanulomana. Why? Because mainly here, since it is a Vatavyadi, our main line of management will be Basti. So before Basti, it is always better to go for a Koshta Chodana and Vatanulomana by Mrudu Viryasana or Snigdha Viryasana, which is told in Vatavyadi by all the Acharyas. That is Gandharvasa the Eranta Thailam or Nimbamrita the Eranta Thailam can be used for the Snigdha Viryasana. So after Snigdha Viryasana, directly we can go for the Basti Chikilsa. So Basti Chikilsa again, for Anuvasana Basti, we have different Thailas like Sahajradi Thailam, Dhanvantaram Thailam, Kshirabala Thailam, Ashwagandha Grita or Kalyanaka Grita. Considering the involvement of brain and the psychosomatic symptoms, you can consider the Kalyanaka Grita for the Basti, Anuvasana Basti. Kshirabala Thaila, considering the Pitta Samsrishta Lakshanas or the inflammatory signs, you can go for Kshirabala Thailam. Sahajaradi, especially for the neurological motor deficits, we can go Sahajaradi. And the Dhanvantaram for little Dhatu Brahmanam or Dhatu Vardhanam, we can go for the Dhanvantaram Thailam also. And Niruha Basti, two methods we can adopt here. That is, one is the pure plain Kashaya Basti or Shira Basti can also be given. So if it is there is no much symptoms of any Dhadukshaya Lakshanas like muscle wasting or Mamsa Balaksha is not there, we can go for the Kashaya Basti, that is especially Balamula Kashaya Basti, Yeranda Mula Kashaya Basti in pure Vataja condition, Manjishta Kashaya Basti if there is association of Pitta and Vata Lakshanas, if we are seeing any like paresthesia Lakshanas we are seeing, Manjishta may also help because Manjishta Kashaya is told one of the, it is not only told in skin diseases, it is even told in Pakshagata as well as Supti Vata or Swapa. So that can also be selected. Or even Vata Kapha Lakshana, if it is seen like in the form of heaviness of the limb, we can go for Dashamula Kashaya Basti also. Or even if we need Brahmana Dhadu Koshna, then we can go for the Kshira Basti also. So the Bahyopacharas like Sarvanga Abhyanga with Mahanarayana Thailam or Shirabala Thailam, followed by Parisheka Sveda, or again if we need Dhadu Brahmana in the case of Dhadukshaya Lakshanas or muscle wasting, we can go for the Shashtika Shalipinda Svedam also. Other Bahyopacharas like Veshtana can be done with the Vatahara and the Brahmana Thailas. Then Salvana Upanaha, one of the best Upanaha Sveda, Brahmana Sveda told by Susruta in Pakshagata Chikilsa, that can also be adopted here. And again, based on Sthana, as per Charaka, again, Bahu Shirshakade Nasyam Panam Cha Uttara Bhaktigam. That is, if the more symptoms are seen in the upper limbs or in the above the level of shoulder, and again the eye or the Indriya Vadha in the form of loss of vision, loss of hearing, or any such head-related symptoms are more which is seen, then we can go for the Nasya Prayoga, and especially considering the Sthana, that is the Mastishka, again Nasya, Dwaram Hi Shiraso Nasa. So that by using that we can go for the Nasya Prayogas using the Shirabala 101 Avrti Taila or Shadbindu Taila. Shadbindu Taila is especially told for Chudamsha Kesha and Chalidamsha Dandan Durbadda Mulamsha Dradi Garodi Suvarna Chakshur Pradimamcha Suvarna Drushti Pradimamcha Chakshur Baho Balamcha Bi Adigam Dadadi. So it is not only for the sensory function, even it will increase the motor function of the Bahu, that is a hand also. That is the Shadbindu Taila. And the other Tailas like Prasaranyadi Tailam or Karpasa asylum, this can also be used for the nasya. And the adonabhiga vata vyadhi, that is especially if in the MS case, if lower limb is more affected, basti chikitsa and avapida snehapana will be the best treatment. And coming to the shamana prayoga, that is especially kashaya prayogas like the Rasana Panchagam Kashayam, Rasana Saptagam Kashayam. See, Rasana Panchagam Kashayam is one of the best kashaya explained by Sahasra Yogam, that is considering the Rasana Guruchi Merandam, Devadaru Mahaushadam, Pibet Sarvangage Vade, Same Sandhyasti Majjage. That is Rasana Panchagam Kashayam is explained in, it is having the ingredients like Rasana Guruchi Eranda, Devadaru and Mahaushadam, that is Shundi. But it is given in different complicated conditions like Pibet Sarvangage Vade, Sarvangagata Vada is indicated. So multiple sclerosis is having Sarvangagata Lakshana. So it can be given there. Sarvangage Vade, Same, that is Samavada. So here there is involvement of Ama also. So Samavada also is indicated. And Same Sandhyasti Majjage. So Sandhyasti Majjagata Vada also, Rasana Panchagam Kashayam is indicated. So Panchagam Kashayam is in 3 different methods. That is Sarvanga Vada, Samavada and Majjagata Vada. So in MS cases, just again coming to the Rasana Saptagam Kashayam, Rasana Amrudam Aragwadam, Devadaru, Trigantaga Eranda Narnavana, Kwadam Pibet Nagara Churna Mistram, Jangoru, Prishta Trigapasha Shuli. Especially in Vedana Pradana Vatavyadi, Rasana Saptagam Kashayam is indicated. So if in the MS cases, if there is any neuralgia or neurological pain, we can go for Rasana Saptagam Kashayam also, or even Maharasana Kashayam, again one of the best Kashaya told in Sahasra Yogam, where it is told like Sarvanga Kambe Kubjatve, Pakshagade Ababahoge, Gridrasi Amavade, Shripade Apatanage. So even Apatanaga, Sarvanga Kampa, Pakshagata, Kubjatwa, in different neurological conditions, we can go for the Maharasana Kashaya with the proper Anupana. And again, the Dhananayadi Kashaya, one more best preparation, most commonly prescribed preparation by which is told in Sahasra Yogam, that is having the ingredients Dhananayana, Shundi, Shigru, Rasana, Ugraganda, Varuna, Lashuna, Krishna, Chitraga Eranda Kesha, Suradaru, Ganapatya, Barbarai, Sabradambaha, Shamayati Paripidam, Sa Ardida Akshepa Vadan, especially indicated in Ardida as well as Akshepa Vadaga. So Akshepaga and Ardida are 2 neurological conditions. Again, these lakshanas can be seen in the multiple sclerosis. And again, the Masha Baladi Kashayam, where it's whenever we require the Brahmana, that is Masha and Bala, Atma Gupta, that is Swayam Gupta, it is also an ingredient in Kapikachu ingredient in this Kashaya. That can be given whenever we require the Dhatu Poshana or Brahmana action. And again, Rasaushad is like Vadagajankush Rasam, which is specifically indicated Kanachurna Yudam Chaiva, Jingik Padam Bibetanu, Saptaha Gridrasim Hantim. So it is told if it is Vadagajankush Rasa is given with the specific anupanas like Jingik Pada, that is Manjishta Kashaya, and Kanachurna, that is Pipali Churna. This can be used for almost all the Vata Vyadhis. Then Bhratavada Chintamani, Vada Vidvamsakarasa, Samira Panagarasa can also be used. Arishtas like Dashamola Arishta, Balashwagandha Arishta can be given as a Balya Chikilsa. Rasayanas like Bhargava Prokta Rasayana told in Avarana Chikilsa by Charaka, Leham Ba Bhargava Proktam Abhyasate Shira Bungnaraha. So Bhargava Prokta Rasayana is nothing but the Chavana Prasha. Another name for Bhargava Prokta is nothing but the Chavana Prasha. That can be used here in this condition. And Ashwagandha Valaiha can also be used in this condition. Again, especially in our practice in SDM Hasan, we have single drug Rasayana capsules are available. That is SDM Udupi Pharmacy is preparing capsules like Lashuna capsule, Balamula capsule, Yashtimadu capsule, Ashwagandha capsule, and so many other set of capsules are single drug Egamolika capsules are extract capsules are prepared by SDM Pharmacy Udupi. So we are using these as Rasayanas. For example, Lashuna Rasayana with as per Ashtanga Hridaya, Pitta Rakta Vinirmukto Samasta Avarana Avrade, Shuddhova Vidyade Vayo, Na Dravyam Lashunat Param. So Lashuna is the Parama Dravya for any Vata Vyadhi, for both Avrada Vada as well as the Kevala Vada. Lashuna is the best Rasayana. So these type of medications are generally used in our practice. So we are rarely getting the multiple sclerosis cases, but we are, if at all we are getting, especially in the Pakshagata, Chikitsa also we are adopting in this, and we are running a separate Pakshagata OPD in our hospital. So I am myself and my HOD are sitting in Pakshagata, we are consulting in Pakshagata OPD, which we see not only Pakshagata, different other neurological conditions also we are treating in our OPD. So once again, I would like to thank the coordinators Pawan sir, and all the other coordinators, Agnihotri sir, so for giving me opportunity. Thank you so much, sir.
Excellent, Dr. Yadu Gopan. Excellent. For expert comment, I would like to invite Dr. Suhas Sethi is with me. So, Dr. Suhas Sethi ji, for your expert comments.
Thank you, sir.
Very good evening to all of you. Thank you, Dr. Yadu Gopan, for a very nice elaborative session. It was really wonderful sharing your experiences. And as you know, that this is a very common condition which we encounter in the mid-age. And most commonly, apart from the weakness in the muscles, one very important thing that you always come across is the problems in the vision, problems in respiratory problems. So these are the things that should be kept in mind in the practice. And excessive of Svedana is also not indicated in multiple sclerosis. So we should be a little careful in its application. So we should once again thank Dr. Yadu Gopan for his wonderful presentation. Thank you very much.
Thank you, sir. Thank you so much. It was really surprise, sir.
And I am really grateful to Dr. Suhas Sethi ji for recommending a dignitary like you, expert like you. Excellent, Dr. Yadu. Agnihotri sir. Now we will call after Agnihotri ji, Dr. Pranjal Joshi from Gandhinagar. Agnihotri ji, sir, please.
Thank you, sir. Thank you, Professor Pawan Sharma ji. I think I am seeing Dr. Leena Karekar and Santala ji. If Santala ji of Latvia, it's a great pleasure. The name Santala is coming, so we welcome.
As speaker, Dr. Pranjal ji has given name, so we would like to invite Dr. Pranjal Joshi ji. As a speaker, he has given name.
Okay, so after thanking our Yadu Gopal ji, really it's much informative presentation made by him, and he touched all the areas, the etiology factor even, and all the. Now I would like to invite Dr. Pranjal Joshi ji. That's why I'm seeing that he is not there, joined in our participant list. I have not seen even once his name. Only two names are there, Dr. Leena Karekar ji and Santala ji. Or else
we would like to welcome Santala ji. Santala ji, welcome, madam.
Sir, namaste. I would like to one day speak about multiple sclerosis, because I have been treating multiple sclerosis from 20 years now, and I was in Netherlands. So from then onwards, I have been researching about multiple sclerosis, and fortunately, I have nearly 10 cases. In that 4 cases, I have got very good results. No recurrence of symptoms and regression on the MRI. So one day I would like to disclose what I have. Charaka has explained this very well. So I would like to one day take an opportunity on this platform and explain or share my experiences. Thank you very much, sir.
Thank you, ma'am. Thank you. I was just recognizing that you are here. So had I known this fact, we would have made a guest speaker on today itself. But since this time has gone, it's in 10:40, I think. So
no, not today, sir.
Okay, so no problem. Your input is with us, and we will definitely like to have your knowledge on any suitable occasion. Thank you, ma'am. Thank you so much for your joining itself. It's our pleasure. Thank you, ma'am. Well,
thank you, sir.
Now the discussion is open, and we have got only 2-3 persons from whom we can get more and more information. And I think Dr. Professor Nishant Shukla ji is here. He is always having a good, good experience, irrespective of the particular name of the disease. But the discussion which has been made on the basis of the symptomatology and the suspective etiologies, and also some of the he might be having some good info, say experiences. So I invite Professor Nishant Shukla ji to please share your experiences of today's this multiple sclerosis topic of the webinar. Thank you, sir. Namaskar. Oh, oh yes. Meanwhile, Dr. Panjal has joined. So, what would you like to adjust? Whether Professor Shuklaji, if you are in position to guess something, or let us complete Dr. Panjal Joshi as he is our declared guest speaker. So, Dr. Panjal Joshi, if you are comfortable, you can join us and start with speech. And I do hope that 7 to 10 minutes you will be completing your presentation. Okay, thank you. Namaskar. Yes, Dr. Pranjan Joshi, you start with your
Yes.
presentation. Welcome.
Wait a minute, sir.
Okay, okay, okay. No, you can start with as long that you are getting attached with the your PPT. Oh, okay.
Hello, sir. Am
Yes,
I
yes,
audible?
yeah, yeah. Your presentation is also almost uh, on a screen. Yes, role of physiotherapy in multiple sclerosis.
Hello, sir. Myself, Dr. Pranjal Joshi. I am currently teaching in Dalia Physiotherapy College, and I have pursued my master's in musculoskeletal and sports. I am also certified in yoga sciences, manual therapy, and kinesiotaping. Today, my topic is multiple sclerosis and its role of physiotherapy in multiple sclerosis.
Yes, please continue.
As we all know that multiple sclerosis is a progressive degenerative disorder in which and autoimmune disorder in which the body body's immunity fights with itself. Wait a minute, sir. Multiple sclerosis causes damage to nerve fibers in central nervous system, and over time it can lead to vision problems, muscle weakness, loss of balance, and numbness. Several drug therapies can limit nerve damage and also slow the disease progression. These are some symptoms of multiple sclerosis: in central fatigue, cognitive impairment, depression, anxiety, unstable mood, in visual nystagmus, optic neuritis, diplopia, in speech dysarthria, in throat dysphagia, musculoskeletal weakness, spasm, ataxia, in sensation, pain, hypothesis, paresthesis, in bowel incontinence, diarrhea or constipation, in urinary incontinence, frequency or retention. As we know that after every therapy which we can give to a patient, we all we everybody needs exercises or any physical activities which has to be done to improve the musculoskeletal uh, problems which a patient is facing. The benefits of exercise in patient with musculoskeletal is it improves mood, enhances your strength and mobility, boosts your self-esteem and self-confidence, lower overall fatigue, reduce weight gain, enhance function of bowel and bladder by Kegel exercises. How to start a exercise goal in a multiple sclerosis? Patient with multiple sclerosis are advised to consult the healthcare provider and develop an exercise program according to their health condition. Healthcare provider can help achieve the patient's goal by monitoring their progress. Consulting a physiotherapy can help identify specific exercises based on the patient's need. There are some of the exercises in which patient should start from stretching. In stretching, all the muscles which are in related to flexibility in flexion has to be extended, and in all the muscles in extension has to be flexed. Some of the flexion exercises should be done for at least 10 minutes per day, which is warm up plus cool down. In warm up, we start with waking up your muscles or enhancing your muscle power by stretching and strengthening activities, in which weight bearing activities can also be suggested. Stretch gently. The duration of each stretch should be 30 to 60 seconds. Next is aerobic activities. In aerobic activities, we make patient to perform walking, cycling, swimming, water aerobics, etc. In which minimum duration of exercise should be 150 minutes of moderate intensity workout per week is recommended by experts. It is advisable to increase the aerobic activity slowly. Initial days of workout should be for shorter duration, and the duration of workout should be increased gradually. Several 10-minute periods can be used for working out in a day when the person has time constraints. We should provide the patient a resting period of time in which the muscles try to regenerate and cope up with the physical activity or physical stress which we are providing during activities or exercises. In strength training, the strength training exercises are recommended at least twice a week. Varieties of strength training exercises should be included in the regimen, or as it helps improve major muscle groups present in the body. Core muscle strength exercises should be followed as they help strengthen the muscles of stomach, back, and surrounding of pelvis, which helps the patient to walk and stabilize and maintain balance during walking, standing, sitting, and doing performing any such activities. In this, we can also see that coordination should be maintained. For improving the coordination of your hand and body, we ask the patient to sit straight and ask and make them lift the weight in 90-degree angle or 180-degree angle. Finger touch. In finger touch exercises, the therapist stands in front of the patient and asks to touch in different directions. In wrist control and forearm exercises, the patient is asked to rotate the wrist in pronation and supination, flexion and extension, and in deviation of internal and external. Goals of treatment is in relation to impairments. Cognitive function is to be improved. Joint integrity and mobility must be improved. Sensory awareness and skin integrity should be improved. Pain is to be decreased. Motor function should be increased. Muscle performance should be improved. Postural control and balance should be improved. Gait and locomotion is to be improved. Management of fatigue, aerobic activities must be increased. These are some exercises which we can provide and ask the patient to perform. So some of the wait a minute. Some of the aims of physiotherapy is to re-educate and maintain all available voluntary control, re-educate and maintain postural mechanisms, incorporate treatment techniques into ways of life by relating to a activity of daily living, by preventing abnormal movement, and to stimulate all sensory and perceptual experiences. In physiotherapy exercise is much more essential for multiple sclerosis patient. The new research-based exercise program is now in trend, in which active aquatic exercise programs is introduced, in which the effect of effect of these exercises on person with progressive multiple sclerosis is to promote and improve the energy levels and mental health, and aids social interaction in the presence of physical disability. Because of reduced impact of gravity, aquatic training allows patient with even severe paresis of the lower extremities to perform standing and moving exercises. A systematic review and meta-analysis recommends combining aquatic therapy with conventional physical therapy for multiple sclerosis patient has much more improved effects on patient compared to any other exercises. The hippotherapy has a positive effect on balance of persons with multiple sclerosis and improves the quality of life. A systematic review and a meta-analysis of the therapeutic exercise of horseback riding intervention show positive physical and emotional effect of horse riding in individuals with neuromotor development and physical disabilities. Horseback riding improved balance and gait of ambulatory patient with multiple sclerosis and helps the rider by providing effective sensory stimulation and rhythmic anterior and posterior swinging of motion. These are the some exercises which has to be given by TheraBand, in which a patient is assisted with physiotherapy and ask the patient to improve the muscle control and muscle strength by resisting over the TheraBands. Multiple sclerosis interferes with function care exercise. If it interferes with function care, the aggravating factors are patient knowledgeable exercise program, posture, sitting, and remove or treat education physiotherapy input. Consider oral medication, insufficient benefit, consider intrathecal baclofen, phenol, intramuscular botulinum toxin. Thank you so much.
क्या बात है प्रांजल जी, बड़ा गजब किए, बहुत गजब किए, बहुत अच्छा, बहुत अच्छा।
सर एक्चुअली मेरी जो मेन स्लाइड थी वो थोड़ी सी गड़बड़ कर रही है। मैं लैपटॉप में खोल के बैठा हूँ पर वो कनेक्ट नहीं हो रही इससे, इसलिए मैं दूसरी स्लाइड से सबसे सिखा रहा था।
कोई बात नहीं, आपने तो मल्टीपल स्क्लेरोसिस के पेशेंट में जान डाल दी कि अगर औषधियां अपना काम करेंगी, लेकिन वो अगर आइडल बैठे रहेंगे तो ब्लड फ्लो तक की बात कही गई, तो बेहतर है कि जब तक उनका मूवमेंट रहे बॉडी में, या मूवमेंट को बनाए रखने के लिए इट विल इफेक्ट द नर्वस सिस्टम एज ए होल, और मसल्स का जो आपने बताया एक्सटेंशन फ्लेक्शन सारा बहुत अच्छा रहेगा। बहुत ही समसामयिक, हम तो हिम्मत छोड़ चुके थे कि आप ज्वाइन करेंगे कि नहीं बीच में, तो इससे बहुत अच्छा रहा, बड़े शॉर्टली आपने तैयारी करी और डिपिक्शन भी किया आपने पिक्चर के साथ में, तो काफी कुछ एक डायरेक्ट इन्फॉर्मेशन भी बन गई कि कैसे वजन उठाना है, कैसे स्ट्रेट बैठना है। तो हमेशा आपका प्रेजेंटेशन टॉप क्लास रहता ही है, आपको बहुत बहुत
थैंक यू सो
शुक्रिया।
मच सर।
बहुत अच्छा लगा। और अभी हमारे साथ में हमारे डॉक्टर हरीश वर्मा जी जुड़ गए हैं टोरंटो से, आपका स्वागत है, नमस्कार जी। अब बहुत लेट जुड़े, पहले तो आप भारतीय होने के नाते गंगा जी की वाली वेबिनार में भी जुड़ते तो और अच्छा लगता, क्योंकि वो बहुत महत्वपूर्ण थी। और अभी ये भी हमारे स्पीकर चले गए, हम जानते हैं आप कोई ना कोई क्वेश्चन रखेंगे, हमारे गेस्ट स्पीकर तो अभी लीव कर चुके हैं, तो आपके अपने अनुभव अगर इस टाइप के आए हो तो स्वागत है आपका। नमस्कार, आप म्यूट हैं, आप म्यूट हैं, आप, आपका माइक ऑफ है, आपका माइक ऑफ है, आप अनम्यूट कर लीजिए। यस
जी
सर, यस सर।
जी सर। तो सर ये मैं एक इंफॉर्मेशन शेयर करना चाहता था कि अल्बर्टा यूनिवर्सिटी में कनाडा में सैफरन के ऊपर एक स्टडी हुई है मल्टीपल स्क्लेरोसिस में, एंड सैफरन हैज बीन फाउंड वेरी इफेक्टिव इन मल्टीपल स्क्लेरोसिस। तो इस पे और जानकारी आने वाले दिनों में और देंगे। आज थोड़ा जल्दी में हूं, मैंने सोचा कि ये एक इम्पोर्टेंट टॉपिक है, इसमें मैं अपनी हाजिरी जरूर लगवाऊं। धन्यवाद सर। सर अनम्यूट कर लीजिए सर।
आपने ऐसी जानकारी दी और बड़ा अच्छे से आपने ज्वाइन करने की बात रखी, एक इंटरेस्टिंग टॉपिक के नाते। सेम प्रोफेसर शांतला जी ने भी इसलिए आज वो जुड़े हैं, और उन्होंने तो अभी बताया 2 लाइनों में कि उन्होंने नीदरलैंड में करीब करीब पिछले 20-22 साल से उन्होंने स्क्लेरोसिस पर काम किया है, और कम से कम 4 पेशेंट तो उनके इतने अच्छे ट्रीट हुए हैं कि उनको रिलैप्स भी नहीं हुआ है। तो मैंने आपने तो केसर की बात करी, सेफ्रॉन की, तो निश्चित सी बात है वाता व्याधि है, और ये उष्ण वीर्य के क्रम में इसका काम चलेगा तो निश्चित फायदा होता होगा। लेकिन एक कॉस्टली औषधि है, और वो भी प्योर मिल जाए तब की बात है। तो उसमें तो हमारे सोफी साहब और हमारे यूनुस साहब ही बता सकते हैं कि कितना सैफरन अच्छा मिल सके जो इस पर काम करे, और कितने लोग अफोर्ड कर सकते हैं। लेकिन
जी सर।
अब आप हो गए और हमारी डॉक्टर प्रोफेसर शांतला जी हो गई, तो प्रोफेसर पवन शर्मा जी किसी दिन इसका एक पार्ट 2 ले आएंगे, तो उस दिन और चर्चा हो जाएगी। अभी थोड़ा सा कल तो 3 है वेबिनार है, तो इस तरीके से हम मई का कोर्स पूरा कर रहे हैं, क्योंकि टोबैको पर भी है, एल्डरली सिटीजन्स की फिटनेस पर भी है। तो कल का निकल जाने दीजिए, फिर कोई गैप डे पड़ेगा जून में तो हम शॉर्टली ले लेंगे, और अच्छा लगेगा क्योंकि ये ऐसा लग रहा था कि एक टाइम तो बड़ा अनअटेंडेड सा है, क्या कुछ मिल पाएंगे स्पीकर्स की, नहीं मिल पाएंगे, और मिलेंगे भी तो अपनी आयुर्वेदिक अप्रोच कितनी देंगे। लेकिन आज बड़ी खुशी हुई कि आप सब लोग जुड़े और अपने अनुभव बतलाए, तो निश्चित रूप से इसका पार्ट 2 भी लगा लेंगे जैसे ही कोई गैप डे मिलेगा, और आपके और प्रोफेसर शांतला जी के दोनों के विचारों से एक हमारी वेबिनार पूरी बन जाएगी। तो आपका बहुत बहुत आभार, थैंक यू सो मच। एंड
थैंक यू सर।
प्रोफेसर पवन शर्मा जी।
थैंक यू सर।
थैंक यू सर। आज हरीश जी ने दिल जीत लिया सर, दिल जीत लिया।
याद ही
इतनी
कर रहे
दूर
थे।
कनाडा में बैठे हुए
जय
आनंद आ गए, हरीश जी आनंद आ गए। शांतला जी
डॉक्टर शांतला
लातविया
जी
से,
नमस्कार।
हरीश जी कनाडा से,
नमस्कार।
आप दोनों के दर्शन दुर्लभ हैं, और फिर भी आपने आशीर्वाद दिया। ग्रेट सर।
नमस्कार।
सर स्पेन में बहुत अच्छा सैफरन बहुत सस्ती मिलता है सर।
थैंक यू, थैंक यू। आप जुड़ते हैं, मुझे आनंद आता है। और आप, अब मैं 1 जून का कल प्रोग्राम भेज रहा हूँ, आप लोग प्लीज एक्टिवली आगे आइए। आप ही लोग हैं जो समाज को दिशा दे सकते हैं। शांतला जी भी बहुत एक्टिव हैं, और इतनी एक्टिव हैं कि वो भोपाल में रहते हुए भी लातविया हैं। जय हो मैडम, जय हो आपकी। वेजिटेरियन होते हुए नॉन वेजिटेरियन कंट्री में एडजस्ट कर रही हैं, जो मैंने वेस्ट बंगाल में 33 साल किया। रियली ग्रेट मैडम, ग्रेट ग्रेट। You have courage.
Okay, sir. One other day, I request time on your platform to speak about multiple sclerosis, my experiences, and what Charaka has explained. Thank you very much, sir.
No, I have means listen your inspiration. Definitely, I am going to arrange multiple sclerosis with you and Harish ji only.
Okay.
Thank you very much. So nice of you.
Thank you,
Good
sir.
night.
Thank
Good
you.
night to all.